Hi everybody, it's Dr. Hall. We're going to go through the structures of the lower respiratory system now. So first of all, I want to show you in the muscular wall of the torso, in between the ribs, we have two layers of muscle that you need to know. The most superficial one that has a fiber direction going this way, I always think of it like I'm putting my hands in my pockets this way, down and in. That's the external intercostal muscle. And then deep to that, with fiber direction going the absolute opposite, perpendicular, up and in, is the internal intercostal muscles. So we have external intercostal muscles, and then deep to those, the internal intercostal muscles. And those muscles help expand and contract the spaces between our ribs when we are breathing. If we look inside the thoracic cavity now, we're going to see those two lungs, the right and the left. The right lung is divided into three lobes. You have an upper lobe, a middle lobe, and a lower lobe. And they're separated by these dividing lines, which are, in real life, they're like real separations. We have the horizontal fissure here and the oblique fissure here. Oblique means diagonal. In the left lung, we only have two lobes, the upper lobe and the lower lobe, and an oblique fissure separating them as well. The inferior border of the thoracic cavity is, of course, marked by the diaphragm muscle. You can see little bits of it here on the inferior aspects of these lungs, that dome-shaped muscle that's going to move downward in order to create negative pressure to pull air into the system. So let's remind ourselves, we not so long ago talked about the upper respiratory system. Quick review: thyroid cartilage, hyoid bone. This is the epiglottis here. And you might be able to see the vocal folds. Let me take this off so you can see vocal folds, vocal cords. It means the same thing. And you can see them right here. And then down into the trachea with its C-shaped rings. Air is then going to move down the trachea and into the left or right main bronchus. So these are our primary bronchi. So left main bronchus or left primary bronchus, right main bronchus or right primary bronchus. They are then going to branch out like branches of a tree, bringing air to all the different parts of the lungs. And those first branches off the primary bronchi are called secondary bronchi. All right, so once air gets out into the lung tissue, which is very spongy, it's going to go into these little tiny air sacs called alveoli. And then things get microscopic, and so I can't show you that on a model. What I can show you, however, is that the whole inside of the thoracic cavity is lined by a membrane. You might recall this from the beginning of the semester. This is the pleura. The pleura that's on the inside of the rib cage, the inside of the body, is the parietal pleura. That then is going to double back and cover the outside surface of the lungs. So there's going to be a membrane covering the outside surface of the lungs, and that's called the visceral pleura. So air is going to go out into the alveoli. Oxygen is going to diffuse into the pulmonary capillaries. Carbon dioxide is going to diffuse out of them and into the alveoli, right? So that we can do our gas exchange. So let's take a look at the blood vessels. So recall that the red stands for oxygenated blood and blue is deoxygenated blood. So the lungs are actually receiving deoxygenated blood that's coming from the heart to the lungs. So these blue blood vessels are carrying deoxygenated blood away from the heart to the lung tissue. Therefore, these are arteries. So we have pulmonary arteries, and then once the blood gets oxygenated, it travels back through pulmonary veins, right? So in the pulmonary circuit, things are flip-flopped in terms of colors because the pulmonary veins are bringing oxygenated blood from the lungs to the heart, so they are red. And so we have two pulmonary veins on that side. On this other model, you can see, again, here's our pulmonary artery bringing deoxygenated blood out to the lungs, pulmonary vein bringing oxygenated blood from the lungs to the heart. We can also see the diaphragm quite well here, and you can see it a little bit there. If I take the liver out on that one as well, right, then you can see the diaphragm. And that's it for the lower respiratory system.